Discomfort and fatigue. Normally, discomforts associated with childbirth resolve within the first days after birth, but may make it difficult to focus on the newborn's needs. Fatigue often remains a problem during the first few weeks and months, when the infant's schedule is erratic and the chance for uninterrupted sleep is minimal. When the infant begins to sleep through the night, usually 3 to 4 months, the parents can reestablish familiar patterns, and fatigue often becomes less of a factor. Knowledge of infant needs. Parents experience powerful feelings of protectiveness when they discover they can console their infant and the infant responds to their care. First-time parents who are often unsure about how to care for a newborn become very anxious if they are unable to console a crying infant. In addition, many are concerned about feeding and specific procedures, such as care of the umbilical cord or circumcision. Breastfeeding benefits both the mother and the infant, but may add to the stress initially experienced by parents who lack sufficient knowledge and support. Some parents have concerns about spoiling the infant. They may think that responding each time the infant cries causes the baby to cry to get attention. It may be necessary to teach parents that infants cry to indicate hunger, cold, wetness, and a need for cuddling or gentle stimulation, and that responding to crying does not spoil the child. Suggesting a variety of methods to cope with crying may be helpful. Prompt, gentle response to crying helps the infant develop trust in the world as a safe, secure place. Trust is a basic developmental task of infancy and depends on the child learning that caregivers respond consistently and gently in meeting his or her needs. Previous experience. Previous experience with newborns also may affect family adjustment. Multiparas are more comfortable with infants and exhibit attachment behaviors earlier than primiparas, who may spend many more hours in the early discovery phase of attachment. Because they know what to expect, multiparas are more relaxed in caring for the new baby, but have to establish new routines that fit the expanded family. The mother may find it more difficult to have time alone with her partner. She may need more help from family and friends than the primipara because of the lack of sleep and the time and energy involved in meeting the needs of all family members. Women with other children may need encouragement to take time for themselves and time alone with their partner. Support groups for multiparas may be helpful. Mothers who have had a long interval between pregnancies may have forgotten much of the teaching received with the last birth and may need more instruction. Those who previously gave birth to infants with anomalies or infants who did not survive may need more time to feel comfortable with this infant. Expectations about the newborn. Unrealistic expectations of the infant may influence adjustment. Parents who have little experience with newborns may be surprised and disappointed at the newborn's appearance. They may be unprepared for normal newborn characteristics such as cranial molding, blotchy skin, and newborn rash. Nurses should teach normal newborn characteristics in early growth and development. They should assist parents in working through misconceptions about newborn behavior. For example, the capacity of an infant's stomach is small and the infant should be fed frequently. Also, infants are neurologically unable to sleep through the night during the early weeks. Increasing the time the mother spends with the infant during the postpartum stay provides extra opportunities for her to gain comfort with the physical characteristics as well as to learn infant care while a nurse is available to help her. Some mothers may be very disappointed in the gender of their infants or sense that their partners are disappointed. These feelings should be acknowledged and resolved before attachment can take place. For example, a mother of 4 sons might be so disappointed that the 5th child is a boy that she cries and refuses to pick out a boy's name at first. Later, when she holds the baby and begins to observe differences between the infant and her other sons, she can begin her discovery period with this unique child. Maternal age. Adjustment to parenthood is a challenge for the teenager who has not achieved a strong sense of her own identity. In general, the adolescent may talk less, respond less, and appear more passive or less affectionate with her infant than older parents. She needs special assistance to develop necessary parenting skills that promote optimal development of the infant. Maternal temperament. Maternal personality traits greatly influence attachment. Mothers who are calm, secure in their ability to learn, and free from unnecessary anxiety adjust more easily to the demands of motherhood. Conversely, mothers who are excitable, insecure, and anxious have more difficulty. Temperament of the infant. The infant's temperament also affects maternal adjustment. Infants who are calm, easily consoled, and enjoy cuddling increase parental confidence and feelings of competence. In contrast, irritable infants who are difficult to console and do not respond to cuddling increase parental frustration and interference with attachment. Availability of a strong support system. Strong, consistent support system is a major factor in the adjustment of the new mother and the family. Friends and relatives who are parents can provide role modeling that is particularly important to first-time parents. They also can provide encouragement, praise, and reassurance that they are good parents. That others see the baby as special and demonstrate love and affection is very important to the new parents. Support may be needed for an extended period after childbirth. In addition, the mother needs practical assistance with household tasks such as meal preparation, laundry, and shopping. Postpartum support groups are often available and can help the mother with early concerns of this period. They provide an opportunity for women to share their experiences with women who are having similar experiences. Some groups are focused on breastfeeding or exercise, but others simply provide an opportunity for interacting with other new mothers. Fathers may be included at all meetings or occasionally. There are also support groups just for new fathers. Other factors. Cesarean birth. A cesarean birth, especially one that was unexpected, can make parental adjustment more difficult. Cesarean childbirth includes a longer recovery time and additional discomfort for the mother, increased stress for the family, and possible financial strain. The mother's needs for recovery and attachment with her newborn should be considered in planning nursing care. Preterm or ill infant. Birth of a preterm or ill infant results in additional concerns about the condition of the infant. Prolonged separation of parents and child may be necessary. Although attachment can occur in these situations, separation may delay the process and create stress on the normally functioning family. Birth of multiple infants. The birth of twins or triplets often follows a high-risk pregnancy in which the mother was confined to limited activity. There may have been one or more hospitalizations for preterm labor or other complications. The infants may be preterm and have health problems. Financial strain may occur because the mother had to stop work earlier than expected, and expenses associated with the birth and future health care are higher. In addition, birth of more than one infant makes family relationships more complex, especially if there are other children. Problems of attachment may occur when there is more than one newborn. Rooming in helps parents gain confidence in caretaking and facilitates the attachment process. If infants are in a neonatal intensive care unit, early frequent contact should be arranged. Parents attach to the infants separately as they get to know each infant's unique characteristics. They need help to relate to each infant as an individual rather than part of a unit by pointing out the individual responses and characteristics of each infant. Arranging time for the parents to interact with each child alone, especially in the early getting acquainted period, is important. Mothers may be overwhelmed at the prospect of breastfeeding more than one infant. They need reassurance that they will produce an ample supply of milk for each infant because supply increases with demand. Cultural influences on adaptation. A major goal of nursing practice in the postpartum period is to provide culture-specific nursing care that fits the health beliefs, values, and practices of each woman. This can be difficult because of the wide ethnic diversity in countries such as the United States and Canada. A major challenge for nurses is to be aware of cultural beliefs and acknowledge their importance in family adaptation. The postpartum period often is thought to be a time of vulnerability for the woman and infant. Many cultural factors relevant to this time can be grouped into communication, health beliefs, and dietary practices. Communication. Verbal communication may be difficult because of the numerous dialects and languages spoken. An interpreter should be fluent in the language of the same religion and of the same country of origin if possible. Care of the non-English speaking patient will be challenging for the English-speaking nurse and healthcare team. Patients who are not able to speak or understand the primary language spoken at the hospital require extra vigilance and support. Extra time and patience may be needed to provide the best possible care. Making an effort by speaking a few words in their language, demonstrating a caring attitude, and using nonverbal communication is a first step. Using an interpreter will improve adherence to discharge instructions, satisfaction with care, and outcomes. Hospitals are required to provide professionally trained healthcare interpreter services and translated printed materials for limited English proficient patients. Culturally and linguistically appropriate services may include telephone or video interpreters, trained volunteer interpreters, or computer-assisted translation. Using the patient's family and friends, children under 18, other patients or visitors, or untrained volunteers is not best practice. Try to meet briefly with the interpreter in advance to make a plan. Speak slowly and in short segments. Speak directly to the patient, not to the interpreter, and ask the patient or family member to repeat back what he or she understands. When the nurse and family speak different primary languages, verifying the family's understanding is important. Nodding or saying yes may be a sign of courtesy rather than understanding or agreement. To be certain the message has been received, the nurse should ask family members to repeat in their own words what they have been told. A woman may not indicate that she disagrees with what the nurse tells her to do because she does not want to show disrespect. She may simply not follow the nurse's instructions. She might also follow cultural requirements that differ from the nursing expectations. Even if she does not really believe the requirements are necessary, she may follow them to avoid offending close relatives. Respect for privacy and modesty of all people is important, but modesty is especially important in Hispanic, Middle Eastern, and Asian cultures. Laws of modesty require that Muslim women cover their hair, body, arms, and legs except when at home with family or in all-female company. Health beliefs. Cultural beliefs and practices provide a sense of security for new mothers. Provision of care for the mother and baby by female relatives is a common thread among cultures. For many Southeast Asians, the postpartum period is important to ensure health in later years. New mothers are expected to rest for 1 to 3 months, while the grandmother or other female relatives assume the mother's usual responsibilities of cooking or housework and care for the mother, her baby, and other children. Care for the Korean mother and baby is traditionally performed by the mother-in-law. Women's activities are often restricted for a period after birth to allow rest and recuperation. The time involved varies. Laotian women stay home for 1 month near a fire or heater to help dry up the womb. Native American women and their infants stay indoors and rest for 20 days or until the umbilical cord falls off. Doing the month is very important for Chinese women. Mothers and their babies are cared for by a grandmother. They do not go outside and must keep warm to avoid wind chill. They wear long sleeves and long pants and restrict bathing and washing their hair. Many Southeast Asian and Hispanic women believe the mother should be kept warm to avoid upsetting the balance of hot and cold. Use of ice for perineal edema or breast engorgement may not be acceptable to these women. Many Mexican women follow the customs of La Cuarentena. The 40-day period is a time when the woman is considered at risk because the entire body is open and subject to entrance of air, which would cause illness and various body aches. The woman may bind her abdomen and wear more clothes than usual to avoid becoming cold, even when the weather is hot. Sexual intercourse is avoided to prevent serious illness to the mother, father, and infant. When women are unwilling to take baths or showers in the postpartum period, nurses may be concerned about hygiene. Perineal cleansing is generally acceptable. If a sitz bath is indicated and this is explained to the mother, she may agree if she is kept warm throughout the process. Although an opportunity to wash or shower should be offered, it is up to the woman to decide her preference. Tact and sensitivity are necessary to determine what care is appropriate for each woman and to find a compromise, if necessary. In some cultures, baths are an important part of postpartum recovery. Navajo women take a ritual bath on the 4th postpartum day. Specific religious practices should be accepted and supported. For instance, Muslim mothers are exempted from their obligation to pray while they are bleeding. However, the father and other family members kneel, place their heads on the floor, and pray 5 times a day. If possible, a clean, quiet room should be provided so that this obligation can be fulfilled without having to leave the birthing center. Dietary practices. Some cultural dietary practices to consider center on the hot-cold theory of health and diet. This theory refers to the intrinsic properties of certain foods instead of the temperature or spiciness of foods. For example, some Asians believe that after childbirth, a woman should eat only hot foods such as chicken, meat, and fish. Others eat warm, salty foods and avoid fruits and green vegetables after childbirth. Although ice water is commonly given to hospital patients, it is not acceptable to many Asians. For example, Southeast Asian women may refuse cold or ice water and prefer hot water or other warm beverages to keep warm. Food brought from home is a welcome sign of caring in many cultures. This is especially true if traditional foods are eaten after a woman gives birth. Nurses should encourage this practice and discuss any dietary restrictions with the family. Home and community-based care. Because many mothers and infants are discharged from the birth facility soon after childbirth, some assessments and interventions described in this chapter occur in the home or clinic setting. Mothers may leave the birth facility when they still have discomfort and are just beginning to recover from the childbirth experience. Consequently, most psychosocial concerns such as family adaptation and postpartum blues surface later, when support from healthcare professionals is not as readily available. Methods currently used to provide care for mothers and infants after discharge include telephone calls, nurse-managed postpartum clinics, home visits, and baby lines, staffed by nurses who provide information and guidance for callers. Comprehensive psychosocial support, including telephone calls, home and clinic visits, and breastfeeding and parenting education, may decrease the incidence of hospital readmission of normal newborns. Some programs use postpartum doulas or paraprofessionals to help extend the work of nurses in providing support to postpartum women. All methods have advantages and disadvantages. The overlap between nursing care in the birth facility and home makes communication among nurses extremely important. Nurses in the birth facility who perform the initial assessments should make information available to nurses who provide follow-up care. Application of the nursing process, maternal adaptation. Assessment. Several factors, such as the mother's progress through the puerperal phases, her mood, her interaction with the infant, and unanticipated events, affect maternal adaptation to the birth. Identification of patient problems. Adjustment to parenting may be altered when one or more caregivers experience difficulty creating or continuing a nurturing environment. Multiple factors such as fatigue, discomfort, and lack of knowledge of infant care may interfere with parent and family adaptation. Planning. Expected outcomes. Expected outcomes are that the mother will do the following: verbalize feelings of comfort and support as she progresses through the phases of recovery. Demonstrate progressive attachment behaviors, enfolding the infant, calling the infant by name, and responding gently when the infant cries by discharge. Participate in care of the newborn, diapering, feeding, and care of the umbilical cord and circumcision by discharge. Interventions. Assisting the mother through recovery phases. Mother the mother. The early taking in phase is a time to mother the mother to help her transition to more complex tasks of maternal adjustment. During the first few hours after childbirth, she has a great need for physical care and comfort. Provide ample fluids and favorite foods. Keep linens dry. Tuck warm blankets around her until chilling has stopped. And use warm water for perineal care. Monitor and protect. The new mother depends on nurses to monitor and protect her. Remind her of the need to void and assist her to ambulate. Assess her level of comfort frequently and offer analgesia before discomfort is severe and analgesia is less effective. Instruct her not to delay requesting analgesia because it is more effective and the postpartum course is smoother if her pain stays well controlled. Encourage her to sleep. Listen to the birth experience. Be prepared to listen to details of the birth experience and offer sincere praise for her efforts during labor. Use open-ended questions to determine the woman's perception of the birth. The opportunity to discuss her feelings about the experience helps her integrate it and clarify concerns. Many mothers spend so much time on the telephone that completing nursing care is difficult. The mother's need to relate her experiences to family and friends is important, and nurses may be reluctant to interrupt. When assessments and care are necessary for the mother's physical safety, a compromise can be effective. Offering a choice is often helpful. Excuse me for a moment. I need to check you soon. I can do it now or come back in 10 minutes. Foster independence. As the mother becomes more independent, allow her to schedule her care as much as possible. Collaborate with her to plan when such care as ambulation or a shower will be performed. Encourage her to assume responsibility for her self-care and emphasize that the nurse's role at this point is to assist and teach. Promote bonding and attachment. Early and limited contact between parents and infants is of primary importance to facilitate the attachment process. In most hospitals and birth centers, infants remain in the room with the parents unless complications intervene. This arrangement may be called rooming in, mother-baby care, couplet care, or dyad care. One nurse is responsible for both the mother and the baby and provides teaching, and help with bonding as part of ongoing nursing care. The mother participates as she is able. The nurse assists as the mother learns to care for her baby and gradually takes over all care. This provides continuity of care and helps prepare the parents for discharge. Prolonged contact between mothers and infants leads to more touching and caring for infants as mothers learn their infants' characteristics and needs. Nursing measures to promote bonding and attachment include the following. Assist the parents in unwrapping the baby to inspect the toes, fingers, and body. Inspection fosters identification and allows the parents to become acquainted with the real baby, which must replace the fantasy baby that many parents imagined during the pregnancy. Position the infant in an en face position and discuss the infant's ability to see the parent's face. Face-to-face and eye-to-eye contact is a first step in establishing mutual interaction between the infant and parent. Point out the reciprocal bonding activities of the infant. Look how she holds your finger. He hasn't taken his eyes off you. Encourage the parents to take as much time as they wish with the infant. This allows them to progress at their own speed through the discovery or getting acquainted phase. Encourage and assist the mother in putting the infant to the breast. Provide positive reinforcement. Answer her questions about feeding. Model behaviors by holding the infant close, making eye contact with the infant, and speaking in high-pitched, soothing tones. Point out the characteristics of the infant in a positive way. She has such pretty little hands and beautiful eyes. Provide comfort and ample time for rest because the mother must replenish her energy and be relatively free of discomfort before she can progress to initiating care of the infant. A mother who seems uninterested may just need a period of rest or pain intervention to be comfortable enough to focus on the infant. Involve parents in infant care. Providing care for the infant fosters feelings of responsibility and nurturing and is an important component of attachment. In addition, it allows parents to develop confidence in their ability to care for their infant before they go home. Begin with demonstrations as necessary and provide assistance while the parents gradually assume all infant care as their confidence in their abilities grows. Although teaching begins during pregnancy, review information and repeat demonstrations. Demonstrate the simpler tasks such as care of the cord before progressing to more complicated procedures such as bathing. Agreement among the entire staff about how to teach basic care is important. Mothers seek confirmation of information, and they become confused and lose faith in the credibility of the staff if information varies. Allow time for practice and repeated encouragement. Parents become easily discouraged if they feel unsuccessful with early attempts to care for their infants. Suggestions for care should be tactfully phrased to avoid the implication that the parents are inept. You burped that baby like a professional. There are a couple little hints I can share about diapering. Evaluation. The expected outcomes are met when the mother independently performs self-care and verbalizes feelings of comfort and support during her progression through the phases of recovery. She should show progressive attachment behaviors, including enfolding the infant, calling the infant by name, and responding gently when the infant cries. Her participation in infant care should include diapering, feeding, and care of the umbilical cord and circumcision. Applications of the nursing process, family adaptation. Assessment. Partners. The partner's emotional status and interaction with the infant are particularly important because they usually serve as the mother's primary support person. Are the partners involved with the mother and infant? How do they interact with the infant? How much information do they have about infant characteristics and care? What are their expectations about their partner's recovery? Unrealistic expectations of the infant will sleep through the night, smile, be easily consoled, may lead to problems. In addition, if partners expect the mother to recover her energy and libido rapidly, they may become resentful if her recovery takes longer than anticipated. Siblings. Note the ages of siblings and their reactions to the newborn. Are they interested and helpful? Are they hostile and aggressive? How do the parents respond to sibling behaviors? Support system. Family members often provide a powerful support system, and their involvement is important to the adaptation of the family. Are grandparents available and involved? Do sisters and brothers live nearby? Are they available to help the new parents? If the family is unavailable, who provides support? What arrangements have been made for assistance? Nonverbal behavior. Nonverbal behavior is equally important. Are the parents' words congruent with their actions? Validate impressions and conclusions during a psychosocial assessment. One of the best ways to do this is to ask questions such as, how much experience have you had with newborns? How are newborns fed in Vietnam until the mother's milk comes in? What are your plans when you go home? How long can your mother stay? Intersperse questions over time during normal caregiving. The mother should not be made to feel she is being interrogated because the nurse asks so many questions at once. Identification of patient problems. Family assessment identifies family strengths and areas in which nursing interventions could promote family adaptation or prevent disruptions in family functioning. Sometimes a family that usually functions effectively is unable to cope because of a specific event, such as the birth of a baby. Lack of knowledge of an infant's needs and behaviors, stress during the early weeks at home, and sibling rivalry can interfere with the usual family functioning. Planning expected outcomes. Goals and expected outcomes may overlap with care after discharge because they often cannot be evaluated before the family leaves the birth facility. By specific date, the family will do the following: verbalize understanding of the infant's needs and behaviors, identify methods for reducing stress during the early weeks at home, describe measures to reduce sibling rivalry, identify external resources and the family's support systems. Interventions, teaching the family about the newborn. Many families access the internet for information about infant care. Mobile phones also can be used for obtaining information. A free service from the National Healthy Mothers, Healthy Babies Coalition provides texts with information about pregnancy and infants through 1 year. The service can be accessed by going to the website www.textforbaby.org or texting baby to 511411 on a mobile phone. Infant needs. Some new parents have unrealistic expectations of the newborn. Provide them with information about the infant's capabilities as well as the infant's emotional and physical needs. Infant signals. Discuss the importance of responding promptly and gently to cues such as crying and fussing that indicate the infant needs attention. Reassure parents that responding to cues does not spoil their baby, but helps the infant learn to trust the world is a safe, secure place. Help parents recognize signals that indicate when their infant has had enough interaction and wants to avoid further stimulation. These avoidance cues, such as looking away, splaying the fingers, arching the back, and fussiness, indicate that the infant needs a quiet time. Helping the family adapt. Providing anticipatory guidance about stress reduction. Help the family plan for the demands of the first weeks at home by providing anticipatory guidance. This is a time when the need for rest is great, but the opportunity for uninterrupted sleep is minimal. As a result, fatigue is a common problem for both parents. The nurse should do the following: emphasize that the priority during the first 4 to 6 weeks should be caring for the mother and the baby. Recommend that mothers establish a relaxed home atmosphere and flexible meal schedule because attempts to maintain a rigid schedule or a meticulous environment increase tension within the family. Recommend that the mother sleep when the infant sleeps and conserve her energy for care of the baby. Encourage parents to let friends and relatives know sleep and nap times and request that they telephone and visit at other times. Advise parents to place a do not disturb sign on the door and to silence the ring on their phones during rest times. Suggest the parents limit coffee, tea, colas, and chocolate because they contain caffeine and will interfere with rest. Teach breathing exercises and progressive relaxation to reduce stress and energize, especially when a nap is not possible. Encourage both parents to delay tiring projects until the infant is older. Remind them that although schedules are chaotic for a while, the infant's behavior is generally more predictable by 12 to 16 weeks of age. Encourage open expression of feelings between parents as a first step in coping with stress. Remind parents of the need for healthy nutrition and recreation. Fatigue and tension easily can overwhelm the anticipated joys of parenting if no respite is available from constant care. Suggest that new parents enlist grandparents, other relatives, and friends to help with cooking, cleaning, shopping, and care of other children. Helping the partner co-parent. Help the partner become involved with his infant by including him in teaching. Provide opportunities for him to participate in diapering, comforting activities, and feeding or helping the mother breastfeed. Offer frequent encouragement and praise. If classes or chat rooms for men who are new parents are available, refer the father to them. Providing ways to reduce sibling rivalry. Suggest that parents plan time alone with older children. Frequent praise and expressions of love and affection help reassure older children of their places in the family. Suggest that visitors and relatives do not focus exclusively on the infant, but include older children in their gift giving and attention. Emphasize the importance of responding calmly and with understanding when a sibling regresses to more infantile behaviors or expresses hostility toward the infant. Acknowledge the child's feelings and offering prompt reassurance of continued love are the most valuable actions. Some children, particularly those older than 3 years of age, enjoy being a big brother or sister and respond well when they are included in infant care. This participation may not be possible with younger children, and setting aside separate time with them to participate in a favorite activity may be more worthwhile for the parents. Identifying resources. In many homes, women assume the major responsibilities of day-to-day homemaking. With the birth of an infant, their task becomes more difficult. A division of labor should be negotiated to prevent undue stress and fatigue. This division of labor is particularly important when other children in the home also need time, attention, and comfort. Although the mother's primary support often is the father of the baby, extended family members, particularly grandmothers and sisters, also provide valuable support. Community resources such as daycare centers, parenting classes, and breastfeeding support groups are available in many areas. In addition, close friends and neighbors often share solutions to specific problems. Remind the mother that resources are available when she begins to feel isolated and exhausted. Evaluation. A prompt, gentle response to infant crying and fussing and verbalizations of acceptance of normal newborn behaviors indicate parental understanding of the infant's need. Devising a plan for obtaining rest and lessening anxiety in siblings is a first step in reducing stress and sibling rivalry. Identifying resources in the family, neighborhood, and community may help the family function to meet its needs during the early weeks at home.